Hi folks, Dr. Ed Beyer here from Beyer Regenerative Medicine. I'm making this video for those of you who have been to one of my seminars on stem cells and maybe have had the injection or haven't had the injection for whatever reason. I'm letting you know that we actually have an alternative to stem cells. It's called hyaluronic acid injections. And we use hyaluronic acid for those of you who are suffering from a lot of knee degeneration and arthritic pain. And it's a good alternative to stem cells. So I want to discuss this a little bit with you today. There's actually three forms of hyaluronic acid. It's really important because most of you know about gel injections, and maybe some of you have had them. They're not all created equal. There's three different forms of hyaluronic acid, and one is far superior than the rest. The first one that most clinics use is called Rooster Comb. That comes from the comb of a rooster. And the problem with this is it contains Avion proteins, and that can cause an immune response, which is not good. Now, human umbilical cord tissue, Whartons Jelly, which is what we use for our stem cell injections, does contain a little bit of hyaluronic acid, but in most cases, especially when it comes to the knee, it's not sufficient enough. So we use a third source, which is the extraction and purification of hyaluronic acid from fermentation of bacteria. The beauty of this, it's bioidentical to human hyaluronic acid, and it's extremely effective and extremely safe. So the product that we use is called Genvisc 850 Hyaluronic Acid Injections from a company known as Orthogen RX. It's non-synthetic, and it doesn't have any Avion protein, so there's no problems with any type of immune reaction, which is the major complaint that we see when people use these Orthovisc and Genvisc injections done in a lot of clinics. This is the most researched hyaluronic acid product in the world. There's over 30 research studies for its safety and effectiveness. It's been approved in over 60 countries, and it's never been withdrawn from the market. So the good and the bad when it comes to this source of hyaluronic acid, first of all, it's temporary. It lasts a certain amount of time. They did do a study called the Amelia Project that shows that in some people, if you do it right, and it's done in a series of 5 weekly injections, the relief of knee pain can last up to 30 weeks. But the National Institute of Health has done a study that shows that when you do hyaluronic acid with properly done stem cells, it's more permanent. It can last many, many, many years. So the actual cost, here's the good part about hyaluronic acid gel injections, is if you're coming to our clinic for knees, Medicare and Blue Cross Blue Shield will cover it if it's for knees only, and it can be repeated every 6 months. If you're coming to us for another type of joint injection or you don't have Medicare and Blue Cross, here's the cost. It's $500 per injection. We do in a series of 5 injections, so they'd be $2,500. If you have to pay out of pocket, we give you a discount of $100, so it's $2,400. We do have a company called Care Credit where you can finance this up to 12 months interest-free. That would be $200 a month, monthly for 12 months, or you can extend it up to 48 months with interest, and the cost would be $70 a month. So what I'm doing, the purpose of this video, is to give you folks who have known me, have been to my webinar or my seminar, and you decided not to do stem cells, or you did stem cells and it didn't work, or it worked to a certain extent. I'm giving you an opportunity to call me now for a free, no obligation, 30-minute consultation, which includes x-rays. And we can figure out whether or not you're a good candidate for hyaluronic acid gel therapy, which is just a very powerful therapy, especially if you've already had stem cells done. Call the number 708-614-1222. I look forward to seeing you soon.